I was in my acupuncture training and I incorporated it into my medical practice for a good 16 years. And finally, I said, this is something that has to materialize, not just a wish or a dream or a passion project or a retirement hobby, but my true Ikigai.
There's so much power in seeing our own suffering reflected in someone else that we admire and respect. Somebody who we had unintentionally excluded from suffering. We were like, oh, they've got it together. It's just me. And then we've hyper personalized our experience of suffering when there's actually so much to be gained from realizing our commonalities.
I think community is something I think we're missing in our broken medical system, and I think a path forward of how we can restore it, and revive it, and bring the energy back to medicine.
You're listening to Solving for Joy. I'm your host, Dr. Chrissy Ott. Hello, everyone, and welcome to today's episode of the Solving for Joy podcast. Today's guest I get to introduce you to is Dr. Paul Yutan. He is someone I have had the pleasure of knowing for a couple of years now through work at JoyPoint Solutions and our common experience in a healthcare organization. Paul is an internal medicine doctor with a focus on geriatrics and palliative care, and he recently opened Westlake Integrative Medicine in Lake Oswego, Oregon, which is a medical acupuncture clinic. And in today's episode, we're going to explore Paul's story, how he has lost and found his spark in medicine. And I can't wait to get into it with you, Paul. Welcome.
Well, thank you, Chrissy. I'm so excited to be here. I'll have to publicly proclaim this is my first public podcasting, but super excited. I've listened to your podcasting format. It's really been quite, I love your guest speakers, and I'm like, oh my goodness, I'm actually one of your guest speakers. What an
Oh,
honor. What an honor.
thank you so much for those kind words, my friend. In our prepping for our conversation today, I know you gave me a little backstory about what it was like to engage with coaching for the first time, and how surprising it's been for you. And that's really where our journey together started. So I'd love if you want to share what it was like for you to first approach coaching as a physician, somebody who was ready to make a decision and a change in their professional life, and how that's been going for you.
Yeah, absolutely, Chrissy. I first met you a few years ago during group coaching. It was my medical group that was really offering this group coaching. I remember it was the second version of it. My medical director actually went through the first round and had positive things to say, and had really encouraged us through an email, really, here's this 12 by 12 format, 12 weeks, 12 people. And to be honest, my first instinct with coaching was like, oh, that's not for me. It's a little bit fluffy, and I kind of put that email aside. But something about it said, why don't I give it a try? Um, so I did. So those preconceived notions were put to rest pretty quickly. Kind of the moment for me was when we were in the 12 by 12, and with our big medical group, we have quite a few specialists. And I remember there being quite a few specialists there, a podiatrist, a surgeon, an OB/GYN, a pediatrician. And what struck me as this aha moment was, this thing where I thought I was siloed and feeling like my clinic was broken, my little microsystem was broken. I heard it was, wow, everyone's saying the same thing. And that was a pretty big moment to share that in such a group, pretty powerful moment for me. Um, yeah, so from there, we learned a lot of skills of how to kind of stand up for ourselves and advocate for ourselves, how to say no, how to set boundaries, all hugely important skills.
We often let those opportunities go by the wayside because they feel, as you put it, a little too kumbaya, a little too let's all hold hands and everything's going to get better. But there's so much power in seeing our own suffering reflected in someone else that we admire and respect. somebody who we had unintentionally excluded from suffering. We were like, oh, they've got it together. Oh, those other clinics must know what they're doing. Oh, those other specialties must be okay. It's just me. And then we've hyper personalized our experience of suffering when there's actually so much to be gained from realizing our commonalities. It's one of the most beautiful things from that, that experience with coaching for institutions where we had so many different specialties and medical sites represented together. And then when you entered 12 by 12 with Joypoint Solutions, we dove a little bit deeper into some of those concepts like finding your value system. And I know that one of the concepts that really resonated with you, that you got a lot of miles at, was finding your Ikigai. Do you want to talk about Ikigai a little bit?
Yeah, so for those who don't know about Ikigai, Chrissy's a great teacher of that. She taught me, basically um, how to find my Ikigai. So, um, I'll do injustice and kind of explain that real quick. Finding that Ikigai is kind of finding what for me, I'll personalize, what my passions are, what my unique qualities are, what my gifts are. So that's kind of that one bubble, and the second bubble would be, what service can I provide to the world? What does the world need? And that would be that second circle, and then the third would be, what can we actually get paid for? And that intersection of the three is your Ikigai, and yeah, I discovered it was my medical acupuncture practice that I really was passionate about. Um,
Yeah,
and I
I
started
remember
in the
that
fall.
moment.
Right. Yeah. I was like,
So
oh,
powerful.
that
I will add one tiny thing. It's four circles because what we're good at and what we love are actually two different circles. Because funnily enough, we can love things that we're not good at, and we can be good at things that we don't love or don't love anymore. So they are represented in this Venn diagram of four, circles in the cardinal directions. And then my addition, especially for those of us in healthcare, is the background circle that encompasses the entire Venn diagram, because we also need the background that says, and it doesn't kill you, right? And it's not something that you are 100% burned out doing. So it's an important ad. But when you have that meta awareness, oh, I am doing what I love. Oh, I am doing what I'm good at. Oh, I am doing what the world needs, and I can make a living. I can do well while doing good. There is there's so much joy. I was going to say satisfaction, but really, I mean, it's a meaning and alignment and delight moment. It is joy, um, which is beautiful to behold.
right. So yeah, now that I found my Ikigai, it's really honing on that and having that kind of be my guiding star of where I want to move forward, with my practice, with how I incorporate, continuing to work with my health system, and how I have my own private practice. So that guiding Ikigai is really nice to be able to reflect on and have that be my North Star.
That's the perfect segue. I was going to ask you, basically when you found it, what did you do with your Ikigai? Because I think that when we started working together, you had not yet opened Westlake, but you were in the process, if I recall correctly. You were like, I'm moving toward this. Let's talk about it. Is this the right move?
Yes, for sure. It's something that I knew I had passion for. I didn't quite have my thumb on it. So to be able to call it something as cool as my Ikigai, um, to have it written down and to have it on paper really solidified it. I think, I could probably, I've was in my acupuncture training and I incorporated it into my medical practice for a good 16 years. And probably 5 years, I've been just letting it brew for 5 years. And finally, I said, this is something that has to materialize, not just a wish or a dream or a passion project or a retirement hobby, but my true Ikigai.
Yeah. And some of that is about deciding, and we can decide things with a lot more confidence when we have a thought partner, when there's a little bit of support around our decision, that we have a a body double or a brain double, if you will, just to be like, this is a good idea, right? I'm not crazy, right? Like somebody outside of my head, just like check in with me. And now you have Westlake Integrative Medicine, which is a beautiful part time practice. And you also still get to serve elders through your medical work, which I know is important to you and something that you're highly skilled at.
Yes, yes, yeah. I haven't quite found the right mix of what I want to do, but I just opened up the practice September of 2024, the Westlake Integrative Medicine, as you may want to call it, a micro practice 1 day a week on Fridays. And just this month, I increased it to 2 days a week. So I'm slowly making that transition, and it feels good right now.
Because I have the advantage of knowing a bit about your backstory, and because we have already discussed sharing it here today, I want to invite you to take us back in time a little bit to before you really knew about acupuncture, and tell us about your journey as a physician with burnout, and a physician who found acupuncture in a surprising way.
Yeah, thanks for giving me that space to share my story. I've been listening to your Solving for Joy podcast, and a lot of your guest speakers have been funny, amusing, entertaining. I thought I would give it a bit, that burnout, maybe a little bit of TCM. TCM is traditional Chinese medicine. I think there's some ways to reframe the burnout model using some TCM. But maybe I'll share a little bit of my story. So you know, I I moved to Portland in 2002 when I joined a large medical system, and back then I remember it was kind of like a very family run type of practice, and I joined as an internal medicine primary care practice. Um, it was certainly fun, very busy. No regrets. I would do it again, but over within about 5 years, I grew my panel to over 1,000 patients, and I loved my patients. They loved me back, and I still think they taught me so much. But unfortunately, I didn't have the skills. I don't, back in 2002, I don't remember burnout being so prevalent, and people didn't really talk about it, at least in my circles. And on top of that, a lot of my colleagues were male, internal medicine male colleagues. And I think that culture was just show up to work, don't complain too much, and get your work done. So looking back, it was kind of this male medical doctor community. Everyone was very well respected, very well educated, and kind of was like, I felt privileged to be there. Like, wow, I'm with these guys and I get to be one of the colleagues.
Hmm.
But we didn't talk about our emotions looking back. And unfortunately, about 5 years into this practice, I suffered from a severe mental and emotional burnout. You know, I think I could go into some of the details, but essentially, it was a very precise moment in time during clinic where I was overworked, sleep deprived, too much on my plate, and my body literally just got ungrounded emotionally, mentally, spiritually. And I actually had to go to the emergency room that day because I just felt so ungrounded. And my colleagues were thinking, Dr. Yutan, something's not right with you. And it took a while to recover from that. It was a big shock to my system. My colleagues, my friends were like, wow, Dr. Yutan, Paul, you've been the calmest person we know. This is so shocking to us to see you in this state.
Mm-hmm.
Um,
It was really out of the blue. And
right.
basically, you just kind of like lost touch with full reality.
Yeah, I remember feeling like it was a dream. I was literally floating around clinic that day and just kind of in this weird trance-like dream-like state that this kind of vibrational energy was vibrating at a very high frequency and I couldn't understand it. And it took a while. So that healing journey, looking back, took a while. Fortunately, work gave me time off work to recuperate. I had a good team of care providers, um, and they gave me the grace to really take time off work, um, and kind of get grounded again. Um,
So you
but
got the
one
support that you needed.
Absolutely,
Hmm.
absolutely. And that's where I discovered acupuncture. I was doing all the Western medicine could do for me, and that was a lot. It was definitely a lot. It was the therapy, the medication, but nothing quite felt settled. Something felt wrong still, and I was like, "There's got to be something and I had not known much about acupuncture at that point. I remember going online and looking up acupuncture practice. I found one that had really good ratings and went for my first visit. And it was really during that first visit that I discovered the healing nature of how acupuncture could help me. I think she understood what I went through with a little bit of a different vocabulary, with this energy vocabulary that they learn in acupuncture school. And it really normalized what I went through. I thought it was very much an abnormal psychotic episode. And to hear words that normalize that, and then not only that, but tools how to get better, um, was a healing process. And it was my first time getting acupuncture, and
Mm.
I remember that vibrational energy that always was there for a few months and never quite came down to my own frequencies. I didn't know how to describe it then, but I remember there were these points on my back, and these points on my back were just vibrating with such intense frequency that I felt them shedding. And within 30 minutes of that, my vibrational energy slowed, and I felt calm for the first time inside.
What was your physician brain thinking on that acupuncture table?
I think the needles were vibrating. I remember I could feel them pulsating with my
Hmm.
heart, and they were probably vibrating. And I was asking my acupuncturist, "Are they actually vibrating?" She said, "Oh yeah, I usually don't see this. I think I'm gonna sit here instead of just leaving you. I'm just gonna sit
Yes.
here, type my notes,
Yes.
and I think I'll just be here with you just to be sure you're okay."
Good choice. Right.
Yeah, I said something else is going on here that I can't explain with my medical school knowledge, but I feel better, and something was getting fixed on a deep sense.
Mm-hmm. Yeah, I really resonate with that description. And also the conundrum that our simple minds find themselves in when we are faced with a technology or a healing modality that is simply outside the box that we've been told exists. For many years, Western medicine, and still in some circles, acupuncture is it's looked down on, or it's very much an area for skepticism, and yet it's been practiced as an art and science for thousands of years. I've been, I was lucky enough to find a traditional acupuncturist in Houston, Texas, in the mid to late 90s. That was my first experience of acupuncture. And it was me seeking treatment for asthma. And I don't remember his name anymore, um, but he would prescribe traditional Chinese herbs after the needling treatment. And he had one of these it was kind of like a sketchy office in a like a an office building that was not like highly aesthetic, okay? And his office was full of he had a shelf full of cigarette packs, because he had helped so many people quit smoking. So they would just leave their cigarettes behind. That was kind of like the lore behind the shelf, which I thought was amusing, but not, again, very aesthetic. And then he would send me to the TCM pharmacy, or herbarium, if you will. And I would get this little paper bag of dehydrated mushrooms and rhizomes and unrecognizable entities that I would go home and then boil for however long and make this god awful tea that I would have to then drink 3 times a day. I'm so glad that we have encapsulated Chinese herbs now, because the real thing was really quite a cross to bear, you guys.
Yeah.
But it did help me symptomatically with my very out of control asthma at that time.
Absolutely. I hear you. My acupuncturist, her name is Lisa May. If you're listening, Lisa, you are a blessed soul. You saved my life, really. Um, she had a home practice out in Portland at a cute little home, and she had a back office space that was so grounded and aesthetic. And she just gave me time. I remember, I think that first visit ran over 2 hours, and she talked about energy, and we call it chi, and she called it chi stagnation and chi disruption. Um, she talked about how she could right away tell that I was this empathetic soul, she called me. And how my patients loved me for it. They came, and I remember, just from that patient doctor relationship, they really loved me for it. But she also told me that empathetic soul of mine attracted some really negative energy. Um, Patients um, themselves, and I was never taught that language in medical school, that language of how to protect myself from others and their negative energy. I learned of words like energy hygiene, cutting energetic cords, and grounding. And it was like going to kindergarten, learning these things. And I wanted to learn them. I practiced them every day. And that was certainly part of my healing journey as well.
Do you use those energy hygiene practices now when you see patients routinely? I wonder if there are like simple descriptions of energy hygiene practices that other caring empaths and caregivers in general might benefit from hearing about.
Absolutely, absolutely. I think when as a I have to be very mindful of it now as I'm working with my hands and the acupuncture needles and the energy work of acupuncture. Yeah, that energy hygiene. It's probably second nature to me by now, but if I had to put three top things, would be I'm really addicted to like washing my hands with really, really cold water after treatment, and just mindfully just washing my hands and not using a towel, just kind of shaking my hands. You might see this on the video of just kind of shaking the water off, and kind
Mhm.
of like that the water comes off, the energy comes
So
off.
does energy.
And right. So that I do. Before I start with patients, I have them ready in the room, but before I enter and knock on the door, I take some grounding breaths and ground myself, for sure. So I ground my space. I ground my space before and after each patient, as a nice way to ground my room.
And what does
So
grounding
yes.
yourself in your space look like? Like, is it just closing your eyes and imagining your feet and feeling the contact on the ground? Or what is the action that is involved if somebody were like watching you? What would they see you do?
Yeah, they probably wouldn't see me doing anything as far if grounding myself, they may see me taking some full breaths in and out, maybe closing my eyes, and just taking that time. Even with sometimes with patients, I'm like, that was a lot of information. Let's both take some breaths with that. And that was a lot of information. Let's process that and just
Yeah.
together do that together.
Yeah.
That's what they may see.
I have a sense of that in, my own practices from being a physician and also from many years ago being a massage therapist, where I was working with my hands and also very, very keen to wash in very cold water, and take that time to sort of disconnect from the energy bubble that we have been sharing in that interaction. But as you alluded to, helping people kind of go back to kindergarten so they have some very like basic steps to follow if they don't have an automatic internalized sense of what it means to ground. It feels kind of like clearing your own energy bubble. It feels like what a deep breath does for your body. Get rid of waste, bring in nourishing oxygen. And it can come with thoughts. It can come with slowing down. It sort of feels like reconnecting to yourself. And as it's called grounding, there's also, um, as we ground electricity to the earth, we ground ourselves to the earth. We are, electromagnetic fields ourselves, and when we ground ourselves to the earth, there is benefit there. And depending on how attuned your sensory perception is, you can sort of feel when you're grounded and when you're not grounded and excessively upwardly displaced, over intellectualizing or wrapped up in a flurry of stressed, rapid, ungrounded thought patterns. Does that resonate? Does that feel
Oh,
true? Is there more you would
yeah,
add?
for sure. So since I felt such therapeutic benefit myself with grounding, and I learned the tools how to ground, and it took a few weeks and months to incorporate into my own healing journey, and now with acupuncture, um, in acupuncture there are these things called meridians, and so there are 12 meridians. Each meridian has a grounding point. So I tell my patients who want some simplified explanation of acupuncture, I said, I'm kind of like an electrician. I'm going to be going into your system and working with your electrical energy system. And what's a good electrician going to do before they work on your house? They're going to make sure everything's grounded so they don't get shocked. And so I said, before we work on you, almost every time I'm using acupuncture points on grounding meridians before we work on the body.
Another corollary to that is when somebody does acupuncture on a spot that's especially activated, or there may be another word in your parlance about it, and you feel that zing. I mean, it is like an electric zing sometimes when there's a hot spot and it gets needled.
Right. Yeah. In acupuncture, we call that de chi, de space qi, de chi. Chi is energy, and de chi is that exact feeling that you talk about. It's supposed to go away after a few breaths. I tell my folks,
Yeah.
if it doesn't go away after 3 breaths, maybe I actually hit a nerve. So please
Yeah,
tell
right.
me. I'm not
Exactly.
I'm not
We
here
do
to be a
still live in
torturer.
bodies, right?
But if it's a strong sensation that then goes and isn't so unpleasant, that's actually in our school. There's this ditchy or not ditchy, and
That's
I'm
so
of the
funny.
I'm of the ditchy family. I think ditchy is important.
Um, it's a nice place to bring in the concept of integration because, I mean, I think most, if not all, acupuncturists are also like thinking about physical anatomical structures as they are treating people. Um, and, as a physician, you are especially aware of things like, oh, yep, there's a peripheral nerve there. Oh, yep, I'm going to needle where, this other thing actually is, even though you're thinking about meridians and, um, you know, relationships in TCM. What is it like to bring those things together through your own embodiment and offer an understanding that is pulling from these different wisdom and knowledge streams?
Yeah, that's a good question. I think with that, I'll say, that my first treatment was, wow, fabulous. It sparked this curiosity. And for me, it says I need to learn more. Fortunately, there are good systems in place. In Oregon, at least, medical doctors are allowed to practice acupuncture with some training. Of course, most people go through some type of training. And there are two main teachers. Had the fortunate I fortunately found Dr. Joseph Helms, who founded the American Academy of Medical Acupuncture back in the 70s, and he had a pretty robust training program. And they were all MDs, MDDOs, learning acupuncture. And so having that Western mind of we all took gross anatomy, and there we were learning acupuncture from square one as a group for 6 months. Um, so that started my journey. After 6 months, I said that wasn't enough. That kind of just whetted my appetite. I need more, and I think acupuncture also was well suited to me because it's certainly a tradition that was passed down from master, teacher to student in this apprentice-like style, and so that really resonated with me. I think that's one pearl of wisdom. Whoever you are out there, listeners, of find your mentor. I've been fortunate to find several mentors, but I can count on one hand the ones that have made such big impact for me. So I found some really good mentors, and so with that, I think I can still be grounded in Western medicine and anatomy, and some points like a sprained ankle certainly is very much anatomy and kind of cooling down a joint and decreasing inflammation and bruising and swelling. But some of it is more energetic, so it's kind of balancing that physiological mind body medicine to more of an energetic practice. So
Super
I like
cool.
doing both.
And we live in a moment right now where even Medicare covers up to 20 acupuncture visits in a year, although it has to be specifically for low back pain. Um, they do cover up to 20 visits a year. It is an important, I think, acknowledgement of the efficacy that, yeah, this has a role.
For sure. For sure. Right. Yeah. I think most of us have back pain to some degree or other, but it would be nice. I think eventually it's a good uh, a foot in the door, and I'm hoping to see that expand hopefully expand into more needs than just low back pain.
Absolutely. And on that note, I know there were a few TCM concepts that pertain to, the thing that we refer to as burnout that would be really interesting, I think, to talk about for our listeners today. One of them being the concept of Jing.
Yeah, so let me talk a little bit about Jing. 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 Jing is defined as vital essence. And this vital essence in traditional Chinese medicine, the teaching is that we were born with Jing. So it's passed down from our mothers and our fathers, and we're born with this vital essence. And this vital essence, they say, governs things like growth and development and reproduction and aging. It's this, really deep constitutional energy. I was actually quite intrigued by it when I was learning it in the TCM model. I said there must be some kind of medical correlation. So let's understand the TCM a little bit more. They say it's a deep constitutional energy that we're born with and can maintain throughout our lives through good, wholesome food and fresh air. And not only that, they said it's stored somewhere. They said Jing is stored in your kidneys. So that's interesting. It was actually described back in 200 BC in this book called The Yellow Emperor's Inner Classic, and they described it as this bodily fluid that's stored in the kidneys. So wow, that kind of sounds like epigen. This
Most people hear
kidney.
fluid and kidney and they think, are you talking about urine? What are you talking about?
I guess in the medical perspective, this Jing, this vital essence, here's something called erythropoietin, and it's produced and it helps stimulate the bone marrow to make more red blood cells. But I think Jing is more than that. It's this energetic philosophy that includes blood, bone marrow, hormones, and um, and when studying Jing, I think the reason for me it pertains to burnout was that here's my vital essence. I think without knowing it subconsciously when I was practicing in the early days with this kind of empathetic soul, I think I was kind of not only depleting my Jing, but actually giving a little bit away each and every time with patients, like without knowing it. Like I didn't know. So it was almost like oversharing or over kind of depleting your Jing.
Mm.
So
Like energetic enmeshing almost, like.
correct, maybe
Mm-hmm.
in just like in my mind, I've got to share some of that essence of mine in order to get you better, right?
Yeah.
Instead of saying, no, you've got to do the work and I'm
Mm-hmm.
here to educate and to help and to prescribe. But part of that early physician mentality was like, I've got to fix you. Um, and we know that that's not healthy. So I think describing that Jing as this vital essence in the TCM model, as they say, it can only last so long. If you deplete it, it doesn't stay forever. It's not an endless resource. This Jing, so you really have to protect it, nourish it with the idea of stress management, eating well. Um,
So you protect it. Does that mean it's not renewable at all? Like once it's gone, or you can kind of get some back.
Yeah, there's two types of Jings. One is this one that you were born with, and then the other. aspect of Jing, yes, you can get it back because I truly feel like I lost some of my Jing, and it took a while to cultivate that back, and now
Huh.
I think you can bring back some of it. So it's not like you
I'm
amputate your arm and your arm's gone, right?
I'm thinking
So
about people who appear to reverse age. They make a lifestyle change and the quality of their skin color changes, and they're they're just different people. You can sense it. That feels like maybe a readable reflection of Jing. I also
right,
love that you like described it as constitutional. Like it's like what we call good genes. Like, oh, you got good genes for that. Or, like there's something about vitality times good genes, but it's maybe a little more ethereal.
true, right. So if you were born with quote bad genes, you still have that essential Jing, and even more reason to make sure it doesn't get depleted, and just being aware
Um,
that it's there. And
yeah, I'm
mhm.
having a flashback to my pulmonology professor at Baylor College of Medicine, Dr. Sheila. Somebody's going to tell me what her last name is because I can't come to me right now. She would say, some people just have bad protoplasm. And she was talking about basically like some people just don't have a lot of resilience. And if we were looking at that through a TCM lens, we'd just say they had low Jing. You say, yeah, something.
Right. So, well, like different language, but maybe
Mhm.
same concept for sure.
Yeah.
I see that quite a bit. It's like, okay, different language, but same concept.
In medical training, we're not nourishing ourselves with good sleep. That's for sure. We're not nourishing ourselves with good food for the most part, except for here and there. And we are exposing ourselves to trauma, to, like just a lot of extreme conditions. And that's in training. Of course, practice is its own story, but I understand experientially how practicing in difficult circumstances or overworking or overextending ourselves in our work could certainly affect this entity.
Right. Right. And when your Jing is depleted, they actually have a prescription. So, TCM says, okay, when your Jing is depleted, here's the prescription. Rest, avoid stress. Those are easy to say, hard to do.
Mm-hmm.
But the ones that are kind of put to practice pretty quickly is the diet. So they say when your Jing is depleted, for sure, they're saying avoid cold beverages. So avoid ice in your water, avoid raw and uncooked vegetables. Instead, cook your vegetables in a broth or soup. Avoid ice cream. Um, and the idea there, it's just an old TCM tradition that's been passed down. Um, my medical thinking of that is, as your chi is depleted, as your Jing is depleted, it takes a lot of energy to chew that celery stick and then incorporate that celery into energy. It may be easier if that celery is cooked in
Yeah.
broth and easier to digest. Um, so it's quite funny. Like during our teaching, we go out to lunch, and our group of lunch includes quite an international crowd, but everyone's like, no, 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 no ice water for everyone here. Just room temperature water, please. Because as doctors, we're all feeling like I think we're all kind of Jing depleted coming into this. So learning
Yeah.
some some easy dietary advice.
Yeah, there's something intuitive that resonates with me about that, although I'll tell you that I really enjoy a very cold beverage. So,
Well, you must
I
have
don't,
very strong Jing. So if your Jing is strong, uh, that doesn't apply so much.
yeah. I think I come by some pretty high Jing from my family. Um, there is another idea we were going to talk about, stomach chi.
Yeah, stomach chi is they talk about, so chi is energy, and stomach chi is not just your stomach, but they talk about kind of the stomach energy, and talk about meridians. And for us, it's more like points to choose to help folks with either IBS or inflammatory bowel disease. But I think for the audience here today, just that idea that stomach chi, I think for me, what it resonates with is another concept in acupuncture is really the idea that, an orally passed down tradition from teachers. And so one of my mentors, her name's Kiko Matsumoto. She's Japanese. She's a pretty well-renowned acupuncturist and teacher. But her teacher was Master Nagano. Master Nagano was a blind acupuncturist in Japan. And from my understanding, in Japan, they took the blind and often wanted to train them in something. So acupuncture was a really well-positioned trade for these blind folks in Japan. And so Master Nagano, he strongly believed in this stomach chi. And the story is that, on his deathbed, he's telling his students, don't forget your stomach chi. And he had a prescription of how to quickly test it. It was by checking the pulse. In TCM, we do pulse diagnosis. And there's on the right pulse, if the pulse is not flowing, and we call it a lack of a stomach chi. And he had a good prescription of points to get the stomach chi flowing. And I've used that time and time again. I've looked for a lack of stomach chi, and if it's not there, it's so fascinating to me that certain points taught by Master Nagano brings the stomach chi back to normal, repeatable on pulse taking, and that not only that, but just the patient feels better. All of a sudden, they go from severe chronic constipation to patient comes back and, doc, I just had a gold star bowel movement last night after you fixed my stomach chi.
That's amazing.
So
How long does that stay kind of quote unquote fixed after a single treatment like that? Is that a hard question to answer? I don't even know if that's a question to
yeah,
ask.
it's certainly not a one-time fix by any means. I think we have to
Mhm.
kind of take a deeper dive into why the stomach chi is weak in the first place.
Yeah.
And yeah, that kind of brings me back to why is the stomach chi so weak in these folks. I met we had this kind of nerdy discussion with the group that I'm in every year. And one of the docs I talked to, her, she's an integrative pediatrician, functionally medicine trained, board certified pediatrician, Dr. Paki Chanturi. And we were talking about this, and she was getting burnt out because she was seeing more and more autistic kids in her practice. And, she was saying these kids would have very weak stomach chi. Um, she didn't necessarily do the points I was talking about, but the way she fixed it was she took these kids off gluten and off dairy completely. And she was telling me her jaw dropped the first time when moms came back and says, my kid went from a nonverbal autistic kid to putting, 5 words together, and now, putting 3 sentences together. And this was repeated, so she put out this, I'll put it in the link, but she put out this call to action YouTube about our broken system, our broken food system. And in her practice, she kind of fixes this weak stomach chi with a more wholesome diet. She talks about how there's too much industrialized farming, too much pesticides in our food system, and talking about how a gluten-free, dairy-free diet really helped her panel of kids with autism. Yeah.
Interesting. I am really intrigued and have been for about 20 years with experiences of NAET. It stands for Nam-Budrapad's Allergy Elimination Technique. And I discovered a while back that you have some training in NAET and can treat people in this way. And I'll give you my physician slash layperson understanding. I always preface it, historically as a, integrative physician in primary care practice, I would tell people about NAET, and I would always preface it with, it sounds really kind of magical and a little bit woo, but I've said it before and I'll say it again. Woo for me means wildly open to outcomes. So we may not understand how it works, or at least I don't, but it involves, some applied kinesiology testing where you're holding a vial of something to test if you are actually sensitive to it. And you may already know that you are, but it's blinded, so you don't necessarily know what you're holding. Only the acupuncturist or therapist does. And once it's identified what you're sensitive to, that kind of gets noted down. And then one by one, in a particular order, you go through desensitization. And each treatment basically just looks like an acupuncture treatment, but you're holding this vial that you're desensitizing to in one hand. And then very diligently avoid exposure or physical contact with that item for 24 hours. And then you're, boom, like no longer sensitive to it. Like it's supposed to be kind of a one and done thing. And my first experience of it was with just a friend in Houston who saw somebody who had this. She was extremely sensitive to sugar. Like she would get migraines, she would have many physical symptoms. She could not tolerate sugar, and it was kind of bumming her out. She had a treatment, and suddenly she could have dessert like anybody else. And it sounds kind of like not a big deal, but for her, it was a quality of life boost for sure. Um, in my own experience during our fertility journey, acupuncture was a thing I used a lot. But in the NAET realm, we were like, okay, so we're just going to work on anything that comes up. And she had me put a bowl of water in my bedroom to collect the particular milieu of dust and allergens in my sleeping space, because at that point, my asthma was still quite active. I would sleep with a rescue inhaler under my pillow or on my bedside table because I needed rescue inhalers still that often. And after treating this milieu of dust mites and whatever with NAET, I literally cannot even tell you when was the last time I needed an inhaler. Like, it's been years since I needed an inhaler regularly. I
Wow,
keep one
that is
around out of
amazing.
habit, but I literally
Hmm.
do not have asthma anymore. And I was on like steroid control. Back in the day, I was on theophylline, like, ugh, all the things. So that's my testimony about NAET. And so when somebody comes to me or tells me about a food sensitivity, especially, or, environmental allergens, I'm always like, oh, I want you to go to an NAET practitioner, but I don't think they're always easy to find. So after that long introduction, what do you have to share about NAET, Paul?
Oh my goodness. This was not planned, Chrissy. I'm so glad you brought that up. It was in my initial training. It was in 2008, Helms Medical Institute. We went down to Tempe, Arizona, about 4 times in that 6 months, and the rest were book learning. And we'd come back and say, okay, this is what we learned. And I got to be really good friends with this pathologist. His name is Roy Namboodrapad. And I was like, Roy, what are you doing here? You're a pathologist. You don't see patients. You see them when they're dead. But I kind of I
You
give him
just
a
see
hard
their
time.
tissue. Yes.
But Roy Namboodrapad, and he was basically like, "Do you know my mom?" I'm like, "No." He's like, "You should meet my mom. She's pretty genius." Not to brag. And back then, we were sharing stories of my son Noah, who's now 16, and he was born an allergy baby. I swear, he was bloated, swollen, eyes shut almost, nasal congestion coming out of every orifice in his mouth and nose. And he basically said, "You need to go see my mom because Noah would get better," and he did. So Roy is the son of the founder of NAET. NAET stands for Namboodrapad Allergy Elimination Technique. And Roy is still quite active to this day, promoting NAET. He actually stepped down from being a medical doctor for just a bit and went to law school. I'm like, Roy, what are you doing? He's like, well, I've got to really, my mom started NAT and it's wonderful, but I'm here now to make it legitimate, to, take the woo out of it, to make it more acceptable because, it just is helping so many people. And a lot of folks don't go to it because if you look it up, it's, unfortunately, early on it had some negative press as being a little bit too woo and not grounded in science. But so he's really out to kind of ground it more in science and publishing these papers going back to autism. Just during our last convention, I told the pediatrician, I said, You've got to meet Roy. You and him are both doing this awesome work in autism. One's doing it by making these changes in the diet, and here NAET with Devi Namboodrapad, she's got a huge paper that they're about to publish on autism and NAET. So I love making those connections, and they're they're getting together and talking more. I think, she's going to be able to definitely get more patients onto this study so that he can get more robust data behind that paper he's trying to publish.
That is awesome. If there is anything that, I or Solving for Joy podcast can do to help accelerate that work, I am here for that because I see it as so valuable. And while it's difficult to describe using, our limited paradigm of understanding, material materialist methods, I think it's in the quantum field. I think that it's just a little beyond our ability to understand, and we're sort of accidentally using something that works that we can't yet describe. Not
Right.
accidentally, it's on
Yeah.
purpose,
So,
but
so yeah. Roy's my friend, and we'd go out for dinner, and I'm like, okay, Roy, you're a pathologist. I'm an internist. Just break it down for me. What's up with this NAET? This was early on, right? Give me what is this? And he goes, Paul, I can't really explain it. It's just, it's one word. It's energy. It's
mhm,
energy. And
mhm.
and so as you well described, it's holding a vial. Devi herself was quite ill when she was in her late 20s and had to go on a pretty restrictive diet. She said, for months, all she could eat was rice. And that, anything else besides rice, she would get sick quite violently, was losing all this weight. So she studied everything she could. She was a medical doctor. She went to go study acupuncture, chiropractic, muscle testing, all of these tools to really help herself. And with that is how she discovered the NAET.
I can't help but see the parallels where, our trials and tribulations, the wounded healer archetype, are often what lead us to our most purposeful work in the world. For you, if you hadn't had a mental health crisis, you might not have ever found how much you love acupuncture and using that as part of your healing expression. If I hadn't been through various trials and tribulations with my own body, whether it's, my history with childhood tuberculosis or my teenage eating disorder or pain from disc herniation or infertility. Like each of these things has informed my work as a healer. Um, and I wouldn't be any of these places without having walked through those particular paths.
For sure.
So
Yeah, no,
same for
definitely.
her, and same for
Mhm.
so many of us who are in the healing fields. Like we use our own healing as traction to amplify.
Right. So I can't explain it, but I've got so many stories of ones that work great. I do a lot of geriatric practice, and I've got this one gal with severe onion allergy. She lives in a adult foster home, and it drove the foster home crazy. They just could not even buy, cook, have any onions in the home. And it was this African American owned place, and they loved cooking with onions. And but because she was there, they honored her and didn't cook anything with onions. But once in a while, they would sneak something in there, and she'd come with me and have terrible headaches and lasting for weeks. Even with just a slight sniff of onions being cooked, they'd have to put like towels in the door just so the onions wouldn't seep through her
Wow.
door. So I
Wow.
did NAET on her, about 4 sessions. The final one culminated in, okay, bring an onion in a glass jar, like a Tupperware, seal it up, and I think you're ready. It's our fourth treatment. I think we're ready to clear your onion allergy. And they can now cook what she can't eat onions. She still doesn't want to eat them, but the house can now cook onions for other people in the foster home.
Wow. I'm curious because I can't help myself. Like, if you had more clearings, if that would get more clear for her. But
For sure. So thank you for spurring that on. One of Roy's things is, Paul, you learned NAET back in the ice ages, he calls it, and now it's this kind of really robust program, and they've learned a lot, and he's encouraging me to, yeah. So it's essentially, yes, you're right. If you have to go through these kind of 12 steps of
mhm,
clearing each micronutrient.
mhm.
But I talked to him about the case, and he's like, I bet you can get her to eat onions, but you definitely, I was I wanted to kind
Yeah.
of get a quick bang for her buck, and I wasn't sure she was be vested in 12 treatments.
So that's
I think,
the rate limiting step for referrals, and it's the rate limiting step for NAET probably in general, is that people may not know until they're told that it's a prolonged commitment, because there are these little steps before you get to the thing that you're most excited about
for
clearing.
sure. Yeah.
And each appointment, is an investment, and maybe there's a world in which there's more coverage for that kind of thing, flexible
Right.
savings
But
accounts and HSAs and things like that. But I digress.
thank you for bringing that up. It's something that I am doing, and now that I'm in my practice, I'm more comfortable doing. Back in my the bigger medical system, I was
Mhm.
not so comfortable. I felt there was a bit of like kind of handcuffs there about kind of what type of acupuncture to practice. But now that I'm on my own, I feel a lot more liberated to really offer more of a robust NAET acupuncture, including NAET.
I love that. So anybody listening who's in the Portland area, you need NAET, go to Westlake Integrative Medicine. Check it out. Paul, I'm so glad that you are in my community, and I know that community is really important to you. You want to say a few things about that before we close out?
Yeah, I think, part of my burnout years ago, what was in finding community through Chrissy's group, through coaching, meeting up at her home and having a community, really. For me, it was my medical acupuncture community. I think shout out to the AAMA, American Academy of Medical Acupuncture, for putting on such robust, journals every month, these annual symposiums, and just a great place for collaboration with my colleagues. I don't miss that. That's one thing I'll do every year to feed my soul. But I think community is something I think we're missing in our broken medical system, and I think a path forward of how we can restore it and revive it, and bring the energy back to medicine.
Yes, bring the stomach chi and the Jing back to the body of medicine.
Absolutely.
Thank you so much for spending this time with me today, Paul. I imagine that there are many people who will benefit from all the things that you've shared, especially the generous share about your own personal journey through difficulty. Can't wait to talk to you again soon.
Thank you so much, Chrissy.
Thank you again to Dr. Paul Yutan for this honest, generous conversation about coaching, energy medicine, and what it really means to ground ourselves in the work we were born to do. I hope this episode offered you a fresh way to think about healing, purpose, and the spark that might be flickering underneath your own story. Next week, I will be joined by my dear friend, Dr. Santi Tanakella, an integrative pediatrician, coach, and host of the I Am Well MD podcast. We will talk about nervous system science, family dynamics, and the power of small shifts to change everything. She even leads us in a beautiful guided meditation, so stay through the end, you won't want to miss it. If something in today's episode stirred something in you, I'd love to talk. I am a physician coach, and whether you're in the thick of something or standing at a crossroads, it would be my honor to help you find your next aligned step. One of the ways I work with people is through the program 12 by 12 Remastered. It is a hybrid group and individual coaching experience with a curriculum that helps you reconnect with your own energy, values, and joy. But everyone's journey is different, and I'll be glad to meet you wherever you are. You can schedule a free exploratory call anytime. The link is in the show notes or at joypointsolutions.com. And as a reminder, I am a doctor, but not your doctor. Everything shared here is in the spirit of connection and joy, not medical or professional advice. If you're a coach, healer, or change maker looking for community, we are gathering in November at the Physician Coaching Summit. You can find all the details at thephysiciancoachingsummit.com. We'd love to have you join us. And if today's episode made you pause, reflect, or think of someone who might need to hear it, please forward it to them. That's how this work ripples outward, one conversation at a time. And as always, so much gratitude to our creative team, Kelsey Vaughn, our amazing producer, Alyssa Wilkes, Shelby Bracken, Dennis Kishcook, and to my partner in life, Sue. And thank you for being here. May you feel grounded in your own wisdom and find a little joy, even in the places you weren't expecting it. We'll see you next time, friends.